Good morning and welcome. My name is Dr. LoSasso, the Medical Director of the West Coast Center of Excellence for Pectus Deformities at the Rady Children's Hospital of San Diego. Looking for a center of excellence for pectus evaluation? Whether you are an interested family member, a patient of any age, or a referring physician, we can accommodate your needs. Come on in. We are a center of excellence in the United States and have been designated as such since 2006. You may ask why I specialized in the Nuss procedure. I'd like to introduce you to Dr. Donald Nuss and the W. Lorenz surgical company that manufactures the bar that corrects Pectus Excavatum. The Lorenz company merged with Biomet Microfixation and offers products for the reconstruction of the chest. In 1998, Dr. Nuss revealed his operation to the world as Surgeon-in-Chief at the Children's Hospital of the King's Daughters in Norfolk, Virginia. The Nuss procedure is safe to perform and offers revolutionary results in almost all cases. I began my association with the Children's Hospital of San Diego in 1985. In 1998, I was personally trained by Dr. Nuss and spent months perfecting both the actual procedure and the multi-specialty teams needed. I launched the program at the Children's Hospital of San Diego in 1999. Since that time, I've had the pleasure of performing the Nuss procedure on over 650 patients of all ages, from as young as 10 to as old as 49. But enough about me. What is Pectus Excavatum? Pectus Excavatum is taken from a Latin term meaning hollowed chest. It is the most common congenital deformity of the anterior wall of the chest caused by the abnormal growth of the cartilaginous portions of the anterior ribs. This produces a caved-in or sunken appearance of the chest. It can be either present at birth or delayed until puberty. Pectus excavatum is sometimes considered to be aesthetic in nature. However, depending on the severity and the level of activity, it can truly impair cardiac and respiratory function and cause pain in the chest and back. People with the condition may experience psychosocial effects and avoid activities that expose the chest. The Nuss procedure is minimally invasive. It involves slipping in one or more concave steel bars into the chest underneath the sternum. The bar is flipped into a convex position so as to push outward on the sternum, correcting the deformity. The bar usually stays in the body for about 3 years, during which time the cartilaginous ribs remodel permanently, correcting the chest. The bar is able to be removed through an outpatient surgery. It's now my pleasure to introduce my nurse practitioner, Michelle Silva.
Welcome. I am Michelle Silva, nurse practitioner for Dr. LoSasso at the West Coast Center of Excellence for the Nuss procedure. I began caring for Nuss patients at Rady Children's Hospital in 2007 as a bedside nurse, and now have the pleasure of working alongside Dr. LoSasso. I am involved in preparing the patient and family for surgery, as well as supporting the patient throughout the entire 3-year journey. I would like to welcome you and review the process and answer any questions you may have now that you know you or your loved one may have Pectus excavatum or Pectus carinatum. If you are a patient with Pectus or the parent of a patient with Pectus, you can feel confident that you are in the right place because we are one of the 5 centers of excellence in the United States and the only one located on the West Coast. Biomet Microfixation and Dr. Nuss himself appointed us the 2nd Center of Excellence after his own Center of Excellence at the Children's Hospital of the King's Daughters in Norfolk, Virginia. Dr. LoSasso has been performing the Nuss procedure since 1999 after he visited and trained directly with Dr. Nuss at the first Center of Excellence. As of 2015, Dr. LoSasso has successfully performed over 800 Nuss procedures. He performs on average about 65 cases a year with a minimal amount of complications. Due to an increase of interest from our adult patient population, Dr. LoSasso has expanded his Nuss program. He oversees an adolescent program at Rady Children's Hospital and an adult program at Sharp Memorial Hospital. Our amazing team will put you at ease, from our caring office personnel to superb operating room staff and specialized nurses taking care of you or your family member during your hospital stay. Our patients try to combine a leisurely family vacation prior to the surgery. U.S. News honored San Diego in their top 10 places to visit in the United States. San Diego boasts the best climate in the world, averaging in the 70s every day. Southern California hosts Disneyland, Universal Studios, and San Diego has SeaWorld, San Diego Zoo, Safari Park, and Legoland. This operation is highly specialized. Dr. Nuss feels that the surgeon must do at least 75 cases before they even have a feel for the operation. There is an artistry to bending the bar that only comes from years of experience. Testing is required preoperatively to assess if the patient qualifies for the procedure. Our amazing Pectus coordinator, Annabelle, will orchestrate all of the tests that are required through your primary care provider. Once your testing is complete, we will schedule a consultation for you to come in and meet Dr. LoSasso and our staff to come up with a plan for your individualized needs. You will meet with Dr. LoSasso and myself 4 to 6 weeks before surgery for a pre-operative appointment where Dr. LoSasso will measure you for your bar or bars and review the surgery in great detail. I will go over what your family can anticipate during the hospital stay, discharge, and recovery home. I'm here to answer all of your questions and concerns. This appointment is thorough and comprehensive, so plan on spending at least 1 to 2 hours with Dr. LoSasso and myself. Whether you live locally or across country, we are pleased to meet you. Our patients from afar have the option of consulting with Dr. LoSasso via Skype for a reasonable fee. Thanks for listening, and I hope this has explained the process to you. If you have any more questions, you may reach me at the office at 760-634-4090. We look forward to hearing from you.
A very good question is, why would a patient want or need the Nuss procedure for Pectus Excavatum? Besides the obvious aesthetic benefits, the stigma attached to having a physical abnormality can actually create psychological problems. This affects not only the patients, but also the family. The husband of a female patient with Pectus once said, "What kind of life can we possibly have if you walk down the block with your kids and you're out of breath?" Pectus is not life-threatening, but from my experience, the quality of life can be affected. I believe the Nuss procedure to be the most effective solution. Please take the time to access testimonials on the icons below. You will find it not only informative, but a celebration of the humanity of our patients. How do you actually start the process if you have further interest in the Nuss procedure? I'm sure you have a lot of questions. If you access the link for FAQs, we may be able to answer a lot of questions you may have prior to an actual consultation. I hope this introduction has been both enjoyable and enlightening. And if I have to see you soon, just know that you'll be in good hands. Once again, I'm Dr. Barry LoSasso, the Medical Director of the West Coast Center of Excellence for Pectus Deformities at the Rady Children's Hospital of San Diego. Thank you for listening, and have a great day.
Can't believe it, is it really me? I'm so happy to be debt free.